All right, chapter 2, the well-being of the EMT. Run through this. So, this is about keeping yourself safe. Our priority is always our own safety first, then our crew, and then the patient. You might say, why is that? Aren't we here for, helping people out and all that stuff? That's absolutely true. However, if we can't be safe and be on the scene, how are we going to help anybody else? So, our safety is always the first priority. If we can't get to the patient, we can't help them. So this requires us to take care of ourselves. We've got to maintain some good personal relationships. If I don't take care of the relationship that I have with others, they don't help me when I'm having issues. So I might need to go to my friend, my partner, somebody, and say, hey man, I'm having some stress at night, having some trouble sleeping. May need to talk about some things, okay? Having a good exercise routine, using that as a way to deal with stress. Going for a run, working out, whatever you do. Getting good amounts of sleep. And if you're having a lot of stress, right, the negative stress, distress, we talk about two types of stress, distress and eustress. Distress is bad stress, eustress is good stress. If you have a lot of that stress, you may not be able to sleep. Eating right. People are trying all these fad diets. How do you think that affects them at work? Could be a bad thing, right? Limiting alcohol and caffeine intake. Caffeine can be a good thing, but you've got to use it in moderation. So if you're just chugging caffeine all day long, do you think it works at 2 in the morning when you need it? The answer is no, it really doesn't. So I always keep some caffeine with me in the truck, but I only use it when I need it. When I'm on that 2 a.m. transfer, I'll pop a soda or two to stay awake, and it's a short-acting thing. If you use it all day, every day, it has no effect on you. And then actually going to the doctor. In EMS, we think we know best, so we don't like to go see the doctor, but we should be doing our annual checkups, getting our blood drawn, checking out things that we can't necessarily understand. So, personal protection, we say BSI scene safe, we need to actually be doing that. What does that mean? We just say it every time at the beginning of our skill station, but what does BSI actually mean? Excuse me. Having your gloves on, making sure you have your eyewear on. We found at our agency that the #1 risk of exposure was splashes in the eye. So we gave everybody pretty expensive eyewear to keep them safe. And it's mandatory on scene. So anytime you're on clinicals, you need to have some sort of eyewear on. Making sure you're doing a good season size up. And following your protocols, very important stuff. So OSHA. OSHA is the Occupational Safety and Health Administration. They've issued a lot of guidelines about this stuff. And if we don't follow OSHA, we can get our agency into trouble, right? So we have to follow not only our local protocols, we also have to follow what the national agency is saying we should do. So here's an example. We use N95 masks. You got those up there. You got gloves, eye protection, all that stuff. Gloves should be vinyl or non-latex and should be readily available. We keep them on all of our units. The big thing is remember to restock them when you run out. Making sure you're taking those off without exposing yourself. We'll go over this later, but folding them inside out as you do it, trying to make sure that you keep clean on clean and dirty on dirty. Hand cleaning. It's always best to actually wash your hand. We do have the alcohol-based hand sanitizer in the truck. However, nothing's better than actually washing your hands with hot soap and water. And not for 2 seconds. You're supposed to do it pretty much the length of the Happy Birthday song, so you can sing that to yourself if you need to, but make sure you're actually washing your hands for some duration. Having that eye and face protection on, especially when you're doing anything that could involve splashing, spattering, or spraying the fluids, okay? Anytime we're doing an intubation or the patient's vomiting, we should have eye and face wear on. So masks. Masks can be the surgical type. Like I said, we use N95 masks. Help prevent us getting exposed to anything that could be airborne. It's a good example. This guy's suctioning the patient. There's vomit everywhere. Yay, look at that. We'll be doing this later on in the course. You'll get to actually suction vomit, see how great it works. But you should have your mask on, your facial protection, in case that stuff splatters up on you. Gowns. We probably should wear our gowns a lot more than we do. The only time our folks typically get out their gowns are on childbirths, right? Everybody maxes up on protection during a childbirth. However, we should be doing that on traumas. When there's blood everywhere and both the legs are hanging off, we should probably have our gowns on. What about diseases? Does this scare anybody? Diseases that could get you? I know that I was afraid of these, and rightfully so. However, they aren't going to just jump out across the truck, and if you're using your personal protective equipment appropriately, you'll probably be just fine. So hepatitis B and C is an infection that causes inflammation of the liver, can live on surfaces and drive blood for several days. That's pretty concerning. several days, right? But can it just jump through your skin and get you? No, not necessarily. So, hepatitis B is deadly. It's killed hundreds of healthcare workers each year before the vaccine was available. Hepatitis C still poses the same risk, and there's no vaccine available yet. Tuberculosis infects the lungs. It's highly contagious and airborne through droplets. You have HIV, which attacks the immune system, leaving the patient unable to fight off infection. AIDS is a set of conditions that results when the immune system has been attacked by HIV. There's a lower risk for healthcare workers than hepatitis or TB with AIDS. Contact with blood is the usual route of infection. So you have to have an open sore or open wound to get this with contact with blood. Ebola. Well, this one's had a big scare for all of us for a long time. In the U.S., there were people infected in 2014. Has hemorrhagic fever, high rate of death, and lack of definitive treatment, although they do have some treatment available these days in modernized society. This is definitely the one I was very afraid of. I said if Ebola got to Missouri, I was going to quit EMS. That could still be true. Ebola hasn't got to Missouri, so I don't know that that's a lie. However, this one is like so bad, and if you watch videos of people with Ebola, they are truly suffering. There's no question about it. And I don't know. That's pretty rough. So don't get Ebola. If you go to an Ebola call, you should be maxed to the very max, and then that truck is pretty much completely out of service and has to be either taken apart and deconned or just thrown away. So. SARS, severe acute respiratory syndrome, spread through respiratory droplets. We haven't had any big SARS scares lately, really big in China. Middle East respiratory syndrome or MERS, found primarily on the Arabian Peninsula, not a big concern over here. Avian flu was pretty scary for a while, found in poultry and can affect humans. It's not as easily transmissible, which is I think why we got ahead of it. Influenza has been around for hundreds of years, kills people every year, still a big concern. You think, well, influenza is not that bad, but it kills elderly and youth populations at a pretty high rate. So, EMS personnel, other than healthcare workers, are at high risk of contact with these diseases, obviously, so we have to be there protecting ourselves, using our PPE to make sure that we don't contract this stuff. OSHA requires bloodborne pathogen training, part of what we're doing right now, but once you're hired, it requires annual bloodborne pathogen training, okay? EMS agencies provide the training, protective equipment, and vaccinations. Employees participate in the infection control plan. So we have to give all the resources and employees are required to participate. So there's the Ryan White CARE Act. I'm pretty sure this is a test question. I like to throw those out there. So I'm pretty sure there's a test question on the Ryan White CARE Act at some point. It allows EMS providers to find out if they have been exposed to potentially life-threatening diseases while providing patient care. In other words, if we know who the exposure came from, we know the patient, they can be required to be tested for any type of disease against their will under the Ryan White CARE Act. Designated officers gather information about potential exposures. So, 2 notification systems: airborne disease exposure and bloodborne or other infectious disease. Once notified of an exposure, the employer will refer you to a healthcare professional for evaluation. So, we're allowed to get treatment and testing. Problem with all that testing is it can be months, right? Months and months and months. Very stressful for you. Much better to stay on top of it, prevent an exposure on the front end. Caring for TB. Got to have an N95 or HEPA mask on when you're caring for TB patients, okay? This is another test question. When you are transporting an individual from a setting in a closed vehicle, it is best to put a mask on the patient and a mask on yourself. A mask on the patient and a mask on yourself. Not just not just the patient, a mask on both, okay? So that's a test question. Pay attention to that. I like to throw those out because if you're watching the videos, that means you're going the extra step, right? There's immunizations available for Hep B and some of the other infectious diseases. We do regular TB testing as well. Each system does it a little bit differently. All right, moving on to emotions and stress. Stress is absolutely inevitable in EMS. I don't think any EMT, when they first get into EMS, understands what stressors they're going to be undergoing. This is a big thing, guys. You don't know how rough this can be, how hard it's going to be on you until you get into the career and you start dealing with some of these calls, and they can be pretty rough. So you have to have those coping mechanisms, whether it's working out, it's going for a run, having somebody to talk to. Those are all coping mechanisms that you can use to deal with this stuff. We got to recognize the signs of stress and develop strategies to deal with it. Each person's different. So I cannot, as your instructor or your boss, help you 100%. You have to be willing to come in and talk and work on things and help yourself. It's a two-part strategy. We're more than happy to help and get you resources, but you have to be willing to take those resources and make the next step. So some physiological aspects of stress. First stage is the alarm reaction, fight or flight. This is that sympathetic nervous system kicking in, saying, here we go. Dropping the adrenal response, saying we're going to work, right? Second stage is the stage of resistance, that coping mechanisms start to kick in. How we're going to deal with this. The third stage is that exhaustion phase, right? It's a loss of ability to resist or adapt to the stressor. We're tired, we're worn out. There's different types of stress reactions, okay? Any situation that triggers a strong emotional response as a result of a critical incident. So the first thing is the acute stress reaction. Acute stress reaction, often linked to a catastrophe, occurs in EMTs and patients. Signs and symptoms develop pretty quickly after. There's physical, cognitive, emotional, and behavioral symptoms. Normal reaction to extraordinary situations. This could require professional intervention, but it's pretty normal to have an acute stress reaction. When we start getting into delayed stress reaction, we start to have more problems. And then we're going to talk about cumulative stress reaction next. That's when we start to get in more issues. So delayed stress reaction is our PTSD. Signs and symptoms aren't evident until a long time after the incident. Most of us don't have time to deal with the incident right away. And so we might have the acute stress reaction right after the incident or the next day. The delayed stress reaction can be months later, right? We're still dealing with this months later. The delay makes dealing with the reaction much harder. Your system has put up walls and it's boxed this in. It's locked all this information in the safe, and your emotions haven't dealt with it. And that just bubbles up and gets worse. And eventually the safe blows open and you've got all this stress coming out. Sometimes we don't know what event even caused the problem. We see so much junk, we have no idea what caused the issue. This typically requires intervention by mental health professionals. And then there's cumulative stress reaction. This is the one I worry about the most. Because every day, as EMTs and paramedics, we see bad things. And they're little chunks of bad things, but they add up, right? So I see a dead person today, and I see a different dead person tomorrow, and I see somebody hanging out of a car, and I see a little kid that's hurt. I see all this stuff, and over time, it builds up if we don't deal with it. If we don't deal with it each day and handle it in a healthy way, so not just drinking alcohol, not just going to sleep, not thinking about it, not talking about it, but we deal with it. We either work out, we talk to somebody, we have a peer that we use, we deal with it somehow, it helps, but if we don't, it builds up. So some early signs, just vague anxiety, right? We're always on edge. They call it hyper alertness or hyper awareness, right? We're always on alert. So I told this story the last time, but I didn't sleep well for years on the ambulance. Had no reason. Even when I was at home, I would wake up to a pin drop anywhere in the house. Something moved in the house, I was awake. The minute I switched to off the truck and was at a desk job for years, well, for over a year, I sleep like the dead now. I was on a hyperactive, hyper-aware, hyper-acute, hyper-readiness all the time. And finally, coming off the truck, I've been able to actually get some sleep. So you don't even realize necessarily what signs you're exhibiting until you're able to step back and say, wow, I might have a cumulative stress reaction. So this progresses to physical complaints, loss of emotional control, irritability, depression. Could be severe withdrawal or suicidal thoughts. May require long-term psychological intervention, right? So different causes of stress. Could be an MCI. Could be any kind of call that involves an infant or children. Could be severe injuries, abuse and neglect, death of a coworker. Guys, we're not meant to see the things we see. Humans are not meant, they are not programmed to see death and destruction on a daily basis or a weekly basis or a monthly basis. We are not meant to see terrible things. So when we see them, our brain doesn't really know how to process it, okay? So we use a couple different coping mechanisms individually. We may lock it all in. We may try to dehumanize it. We may try to laugh about it. So when somebody tells would normally be considered as a sick joke, that's us trying to dehumanize it and trying to make it a little bit more okay, easier for us to swallow. Like, you trust me, you'll hear jokes that you think may be inappropriate, and as you get more and more into EMS, that's a defense mechanism. So signs and types of stress, we talked about this, eustress and distress. I think this is a test question. Positive form of stress is eustress, helps us work under pressure. Distress is negative stress causing immediate and long-term problems. Signs of stress, same things, irritability, inability to concentrate, anxiety, indecisiveness, guilt, isolation, loss of interest in work. So what if your partner's beginning to show signs of stress? How could you help them? Maybe talk to them, maybe give them some counseling ideas, maybe just be there for them, just listen to them. Go work out with them. Lots of options, right? So lifestyle changes can help us. The more exercise we get, I know people are like, well, I don't want to exercise. Well, it helps. It helps shift the focus your brain has off of what you're thinking about to what you're doing. Devoting time to relaxing. Maybe changing shift. Maybe the high call volume is an issue. Switching areas, switching run areas. There's programs called CISDs, Critical Incident Stress Debriefings. Should be a part of a comprehensive system. Allows us to educate, use resources to prevent stress and deal with it, talk it out. Typically when they did these though, they were trying to bring in way too many people. So small groups work better with this, just a few people that you truly trust being able to talk about the incident 24 to 72 hours after the event. So not right after, you have to have some alone processing time. If you have no alone processing time, you're not going to open up in front of other people. So once again, we don't normally see dead people except at a funeral. We don't normally see people hang out of a car dead, right? We don't normally see people die in front of us. We don't normally have people beg us to keep them alive. Those things are not normal. So we have to understand they're not normal and learn to deal with that. Some emotional stages that you may be dealing with stress: denial, anger, bargaining, depression, and finally acceptance. Most people go through all these. Some people go through them faster than others. This could be a patient. This could be us as the provider, either way. So we've got to recognize the patient's needs. We may need to be tolerant of angry family members. We may need to listen. We don't want to falsely reassure. There's nothing worse you can do than saying this person's going to be okay. I talk about this a lot. If you're going to tell somebody, if somebody's dead on the floor and you're doing CPR on them and you need to coach a family member, you need to be very clear cut and say, look, I'm sorry he's dead right now. We're doing everything we can to help him, but he does not have a pulse. He is not alive. And that way they start to understand it. That may sound very harsh, but the phrase is like, he's passed on, he's moved on. None of that stuff really works. It doesn't allow them to start processing from their end. And if you get them back, great, that's wonderful. But you need to tell the truth and be very clear about it. You can offer as much comfort as you can, but a lot of times we need to get these people in touch with additional resources. So calling a counselor or a priest or another family member to help. Scene safety. This is a big one for me because right now we say scene safe, BSI scene safe, and I don't know that your scene is really safe. So I challenge you to pay attention because I guarantee at some point when you say that, it won't be safe in your skill stations. EMS is not usually a dangerous profession, but it's becoming more and more dangerous. Google search, EMS shot at. You'll find a million examples. It's happening all the time. We're getting shot at. There's a reason why we have TAC vests on all of our trucks now. There's a reason why we're keeping that stuff. Why we have a rescue task force model. It's because the world is becoming more violent towards EMS. Scene safety is kind of hard. Sometimes we think the scene's safe, we go in, we may have to back out, right? What about hazmat? Should we have to deal with that? No, probably not, but we do. We got to ensure that we have binoculars. If we see anything smoking or looking funny, we need to stay way far away and ensure it's not a hazardous material scene. We have ERG, emergency response guidebooks on all of our trucks that we can utilize to try to identify materials. I think you need to know what an ERG is if I remember right too, okay? And then we're going to notify a trained hazmat team and keep everybody out. We don't want to treat patients until after they have undergone decontamination so we don't contaminate our truck and everything else, ourselves. Terrorist incidents, could be large or small, could happen here. We've learned more and more small towns have been hit by terrorist incidents, so we need to be aware of that as well. Rescue operations can be dangerous. They're doing extrication. We need to evaluate that situation to make sure we're not doing. You should not pick up the rescue tools if you've never done it. You shouldn't start cutting on a car unless you've been trained to do so. Good example, placards, those little triangles out there on the big tank. There's a smaller tank next to it, probably an anhydrous tank, but I can't see the placards. It's hard to say. So we got to wear safe clothing. We don't want to wear big jewelry, anything that they can pull on, anything that can hurt us, right? We should always have a radio on. We should have safety rules. So if my partner's doing the assessment, I should be his overwatch, step back, watching the scene a little bit more, keeping an eye on things. Never ever stand directly in front of a door, okay? A few things about this door. There's a realtor box there. This could be an abandoned structure. It's hard to say. Never stand in front of a door because they could always shotgun blast through it, and it's happened. They didn't call 911. They didn't know you're coming. They don't know who you are. They don't like law enforcement. Whatever the question is, they might blast through that door. Be observant. Do a good size up. As you walk up to the house, does it look dangerous? Is there a dog? Are they going to bite you? I used to be fine with dogs until I got bit once, and ever since then, I make my partner get out of the truck first. I'm not good with dogs anymore. I don't like him. I keep something between me and the dog at all times. So I'll keep our big med bag, and trust me, I will defend myself with that thing if I need to keep that dog off me. Drive a few feet past the residence. Get a good view of it. Check out all the sides. Look for signs of anything dangerous going on. We got the 3 R's on how to react to danger. We can retreat, we should radio, we reevaluate. Don't re-enter a scene until it's been secured by police. And always flee. Run away, drop your equipment, throw your equipment, take cover and conceal yourself. Okay? Nothing wrong with getting in the truck and driving backwards. We can do it. The benefit would be to not go in the first place, but we can drive backwards if we need to. That's chapter 2. It's all about taking care of yourself, taking care of your crew, making sure you're doing things right. Okay? This takes practice. It's easy to get in the habit of just rushing in, and that's not what we want to do. All right? If you have any questions, let me know. Chapter 2.